Good morning everyone. Myself Dr. Geetanjli Chawla, Assistant Professor from the Faculty of Physiotherapy, RPIIT Campus, Karnal. Welcome to our YouTube channel, that is RPIIT Academics, and do not forget to like and share the video and subscribe our channel, and do not forget to hit the bell icon also. Today we are going to learn about the recommended rehabilitation plan after any surgery or after any abdominal surgery particularly. So on day 0, that is on the day of your transplant or surgery, breathing exercises, bed exercises and sitting up in bed should be taught. And on day 1, sit out in a chair for at least 4 hours, complete breathing exercises and aim to complete 2 short walks the length of your day. On day 2, sit out of bed for at least 8 hours in total and aim to take 2 longer walks the full length of the ward. On day 3, sit out of bed for most of the day and aim to increase the distance and frequency of your walks. Starting with the breathing exercises. Breathing exercises and moving around will help to re-expand your lungs, making it easier to breathe. They also help to clear phlegm from the airways and therefore reduce the risk of chest infections. Take 4 slow deep breaths, holding for 3 to 5 seconds and repeat this every hour during the day. You should continue with these breathing exercises until you are spending most of the day out of the bed and are walking around. It is normal to have more phlegm on your chest after surgery, and coughing can often be uncomfortable. When you cough, hold a rolled up towel or pillow against your wound to provide some support, and coughing will not do any damage to your wound. Exercises in the bed. Aim to complete the following exercises 3 times a day. This will improve your circulation and maintain your movement and strength. It is also important that you try to sit upright in the bed as much as possible during the day to help prevent the other complications. Ankle pumps. Move your ankles up and down repeatedly for 1 minute. Knee bends. Bend one knee at a time up towards your chest and then straighten out. Repeat this 15 times on each side. Straightening the knee with a straight leg. Push your knee down into the bed. Hold this for 5 seconds and repeat it for 15 times on each side. Leg raises. Lift one leg up straight in the air, keeping your knee straight. Hold it up off the bed for 5 seconds and repeat this 15 times on each side. So for the PT management, in the initial first week, IV therapy and one limb should be mobilized, and use of Ryle's tube and application of postural drainage should be done. Sitting out of the bed, if no respiratory complication is there, then allow the sitting for at least 10 to 20 minutes. Remedial aims to prevent post-op respiratory or circulatory complications, it should be done. Primary exercises like breathing, ankle and foot and leg exercises. Diaphragmatic breathing should be instituted. Kinesiotaping should be done if required. Chest raising should be done. Bridging, slow contraction and relaxation of abdomen by placing the hand. Maintain abdominal muscles and trunk muscles activity to strengthen them. Lying and hip drawing up. One leg raise should be done. Crook lying, that is hands on abdomen and abs contractions should be done. Stride lying, moving arm across the chest should be done. Head bending sideways should be done. Leg raises and hold in this position should be followed. Flexion by dangling the legs over the side of the bed. Half lying in bed and ankle movements should be done. Static bed cycle or sitting at the edge of the bed. Balancing exercises should be taught. Sitting in chair with arm support and straight sitting and trunk bending sideways and forwards and backwards. Preparing for weight bearing. Coming in assisted standing and encouraging the patient to hold standing on his own for the time till he is comfortable, and short periods of walking around bed with or without support should be done. Leg raises should be done and walking practice should be done continuously. Redevelop the muscles that are responsible in walking, that is in longitudinal arch muscles, calves and thigh muscles. Re-educate the neuromuscular coordination, balance exercises, and when the patient is stable after a few weeks of surgery, sitting on ball and shaking should be taught. Swiss ball exercises for abs and trunk should be done. Quadruped on ball should be taught. Bridging on ball, lying supine on ball and shaking, and side lying and leg raises should be taught. Cross leg theraband exercises should be done. We can also go for electrotherapy during the post abdominal time. We can go for the abdominal binder, TENS, that is transcutaneous electrical nerve stimulation, hot pack muscle stimulator, and ultrasonic to heal the deep fibers of the that are affected by the surgery of the muscles. Thank you.